Welcome to today's Practice Advantage Pro. Today I'd like to talk about wireframes as a window into clinical care for a service line at a hospital, healthcare facility, or perhaps even a window into a programmatic line of service like maybe a spasticity management or a movement disorder clinic. And what do I mean by that? The wireframes of a website are really the architecture, the structure, or the frames that hold the content, which would be the prescription on my lenses, by which the information is shared with patients, family, and other people that are seeking information about perhaps a spasticity management program. My thesis here today is that the wireframes and the content tell us a lot about how we're organized to provide that care to a patient. What do I mean? How many different places could a patient with spasticity management potentially enter into a healthcare system? It could be through neurosurgery, it could be through a neurosciences institute, it might be through a movement disorder subspecialization, it might be through physical medicine and rehab, it might be physical therapy. There are many different entry points for something like a spasticity management program. How do those get mapped out on the website? Take a look, work backwards, and do an analysis of the different places on the website where that might happen. The second step to this is, how do those different parts or those access points actually interface with each other? Are there ways that they're going to be interfaced across the system so that if a patient enters here, they can still end up in the place you want them to? And do you have a strategy for where you want them to end up? Do you have the prescription right or the focus right for that particular patient to get them to that particular site? Do you have internal search engine optimization? Is your internal SEO really focused on the patient and helping them get to that spot? Now, the reason why I'm talking about this is oftentimes the wireframe and the content, the prescription of the glasses, helps us focus on what's going on from an access standpoint in the wireframe, but also is a window into what's going on actually with patient care. How well is that coordinated? How is aftercare? How are the subspecialties that need to participate in this, whether it's physical therapy, occupational therapy, some of the other therapies interfaced? My recommendation is this: do an analysis of your wireframes, take a look at the content, the prescription, see how that matches in practice what's going on in your particular health system or site where you deliver services, and then form a committee to take a look at, and here's an important part of that committee. It's not just the key stakeholders of physicians and therapists, but it's also patients and families, the people that are going to be accessing this. And invite them in to make sure that it's the right prescription and it's the right frame for them so there's a great fit. Thank you for joining us for today's Practice Advantage Pro.